Sumantri seems to have come up with, she calls it a funny question. I don't think it's funny at all. I can understand that she is not able to cope with having small meals. The portion size, if you're not able to control, it's not a big deal. The reason I said small meals is, especially in the first 3 months, it's difficult for your stomach to digest very complicated stuff. So you cannot have too much of protein. It's very difficult to digest. But at the same time, something needs to go in. That's why I gave the example of a tall glass of buttermilk, because it will fill you up. It will make sure that you're not hungry immediately. At the same time, it's not very difficult to digest. So you make the amount what you are having, if necessary, slightly more, but it has to be easily digestible so that instead of preventing the gas, you don't end up developing more and more acidity and gas. Someone else is asking me about symptoms of early pregnancy. Of course, like I said before, we usually tend to associate pregnancy with vomiting, and vomiting. But it's not necessary that everybody needs to have vomiting. There can be indigestion. There can be a lot of gas. Sometimes there may be giddiness where, someone feels very faint. So a lot of women ask us if they can travel by two-wheeler in early pregnancy. So we say there's no harm traveling by two-wheeler, because two-wheeler per se is not going to make any difference to either the baby or the lady. But if she is on a two-wheeler alone and if she happens to feel giddy, reeling kind of sensation, then obviously it's not safe for her. That is the only reason. And any kind of travel by any mode is safe. So other than the giddiness, women may feel sleepy. They may not really want to do too much of work. It may be a feeling of lethargy, tiredness, wanting to just rest, relax. Back pain is another very, very common symptom. I wouldn't say only of early pregnancy. It invariably goes throughout, because we need to remember that the uterus is not just growing in front. It is growing behind also. It is attached to the low backbone by ligaments. There is a pull on that. And that is where is the importance of your posture. Please sit straight. Learn to do that, because we generally, most of us women are throughout the day on the laptop. We are bending forward. We are abusing our backs. We are human beings. We are not animals where our spinal cord is like this. So we are supposed to be straight. So learn to get into that habit. And then the amount of back pain and stuff will come down. Calf muscle pain, ligament pain, leg pain, these are all common symptoms of pregnancy. I might have missed out on one or two, but then these are the common symptoms.